Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. In this video, I'm going to talk to you about the fundamentals of diabetes. So before we start, let me address any myths or misconceptions that there may be. So let me begin. True or false? This is a 3.5 pound bag of sugar. True or false? If you were to eat this entire bag of sugar in one sitting, would you get diabetes? Answer the question. Diabetes. So what is diabetes? You'll probably see a definition someplace that says diabetes is an endocrine disorder that involves the lack of insulin or adequate amount of insulin from the pancreas. It's a group of disorders. I want you to be very careful when you talk about diabetes. There are really 3 types of diabetes. However, when we talk about diabetes related to glucose and insulin, we're only talking about 2. The third one, which is diabetes insipidus, that's another endocrine, but that's primarily related to water. So for the purpose of this, we're talking about diabetes mellitus, which is affected by glucose and sugar. So in a nutshell, with diabetes, there are 2 types. Type 1 diabetes, there's one problem: lack of insulin. In type 1 diabetes, the pancreas, the cells in the pancreas that normally secrete insulin to help glucose get into the cell, they're either destroyed or functioning so minimally, they're inadequate to meet your glucose and insulin combination into the cell. So type 1 diabetes is one problem. Type 2 diabetes, 2 problems, and here they are. You either do not have enough insulin, meaning your pancreas is still secreting, but the amount is inadequate to meet your needs, or that insulin is having difficulty combining with glucose to get into the cell. So in type 2, it could be a secretion problem, one problem, or a cellular problem. And it's important to understand that because the treatment is going to be based on what type it is. So first and foremost, who's at risk for diabetes? Type 1 diabetes has what's called juvenile diabetes because children got it, babies. Usually early teens would get it. So it's always called type 1 diabetes. Risk factors, we're still unsure. In some families, you'll see it. A father may have it and the child may have it, but your textbook is going to list that type 1 is not familial. However, some environmental factors have been blamed, and also an antigen. Your own body's antigen destroys the cells of the pancreas, and thus you no longer have any insulin. Those are the causes for type 1. Type 1 accounts for about 5 to 10% of the population that has diabetes. Type 2, as I said, 2 problems. Now this amounts to 90 to 95% of the population with diabetes, and this one runs in families. Mother has it, you're greater risk. Sister has it, you're at greater risk. This one is adult onset. Usually happens middle age, a little bit older, but with a society that's so predominantly overweight and obese, you have more and more people being diagnosed with type 2 diabetes in their teens. So in type 1, if the lack of insulin is the problem, the treatment is insulin. Now the different types of insulin is for another time, but the treatment is insulin. With type 2, because you have 2 problems, one could be inadequate secretion, or getting into the cell. So they could actually also prescribe a type 2 diabetic with insulin. So we've moved from calling them insulin dependent and non-insulin dependent because either one could be on insulin. Now, with regards to medications for type 2, when you study your medications, you should understand there's some medications that help the pancreas secrete more. If there's a medication that helps the pancreas secrete more insulin, you need to be prepared for that blood sugar to go down as it would if you were giving them insulin. And there are other medications that actually help glucose and insulin get into the cell. So with type 2, one of the biggest risks, of course, it runs in family, but overweight and obesity increases your chance of getting diabetes. So an individual who's diagnosed as a type 2 with type 2 diabetes, one of the first things they recommend is for this individual to lose some weight. And many times losing weight, this individual glucose levels might level off to a point that they may not need medication. But we understand that losing weight takes time, and you're encouraged not to lose weight too fast. So if a person needs to lose 30 pounds, and we recommend that they lose 1 to 2 pounds a week, while your provider doesn't want to wait such a long time to get those blood glucose levels lower, because a high blood glucose level can damage your vessels, damage your organs, your kidneys, your eyes, etc. So how do you diagnose diabetes? You diagnose diabetes a couple ways. First and foremost, you have to understand what a normal blood glucose is. Whether we take it from a peripheral, a finger stick, or from your blood, like during a full blood level. A normal finger stick, normal glucose is anywhere between 70 to 110. Now, we talk about a random glucose, meaning your blood glucose is checked any time of day, regardless of what you eat. If your blood glucose is less than 200, that's ideal. So if I overindulge on ice cream, or somebody overindulge on that, it may make your sugar really, really high. Doesn't damage your pancreas yet, so you still survive. That answers that question. But you want that to be less than 200. Another way is a fasting. So for instance, you have your normal meal in the late evening, go to bed, and you're not eating during sleep, and you wake up in the morning, and first thing in the morning, you've been fasting. Breakfast, you're breaking the fast. You want that fasting blood glucose to be less than 126. Last but not least, there is a test, used to be called hemoglobin A1C. It's now just referred to as A1C. And what that measures is, it's about 3 months record of how well glucose was attached to the heme part of your blood. Hemoglobin. Your red blood cells last about 3 months, so your hemoglobin A1C can tell about 3 months. So back in the day, we used to use hemoglobin A1C strictly to monitor how well individuals with diabetes was monitoring. But now we figure, well, if an individual comes in and the hemoglobin A1C can give us a number, that's also now used to diagnose a person. So really 3 things: symptoms, frequent urination, frequent eating, and frequent thirst, or thirst, eating, and the 3 P's: polyuria, polydipsia, and polyphagia. Eating, drinking, and urinating are signs of diabetes. That alone doesn't say that you have it. They're signs that your provider may consider doing a random, doing a fasting. So there you have it, ladies and gentlemen, a brief video on the fundamentals of diabetes. If this is your first time to my channel, welcome. I hope you stay. Have a good day.